Hi, everyone. I just wanted to welcome you to today's Reflections on Global Grief and COVID-19 discussion. One moment, I'm going to pin my video. There we go. And before we get started, I just wanted to let you know we had to record this meeting in advance of this conversation, mostly because our guests are from all over the world, so coordinating time zones was a bit of a challenge, but also because, as you'll hear in a moment, several of them are doctors that have emergency schedules. So this was our safest bet. So I will introduce the panelists, and then I will play the pre-recorded conversation. And if we still have time at the end, I'll open it up for questions. So as we are listening to this discussion, please feel free to comment questions or statements in the chat box feature of this Zoom. So without further ado, I'll start with an introduction of myself. My name is Rose Sulentic, and I'm an epidemiologist for a United States State Health Department. Prior to this experience, I was working on the CDC Foundation COVID-19 core response. So I've been working on COVID for about a year. My own interest in how grief plays in is not only a result of working on COVID and personal experiences, but also looking forward into the future and thinking of the other global challenges we have headed our way with climate, with potentially future pandemics. So I will go through now, and I have a couple of other public health professionals that I will introduce now. One of them, Emmanuel Gaeta, is actually a medical student in addition to being a public health professional. He's a medical student at the University of California at Davis. Manny, as he goes by, is dedicated to patient advocacy and improving his community through service. Our next panelist, Adrienne Lefevre, is also a public health specialist. She is a senior health consultant for a public health consulting company and was formerly a COVID-19 contact tracing team lead for a US state health department. She is passionate about prioritizing laughter amid grief, pain, and stress. And next, we have our medical professionals. We have Dr. Ni Hammond. He's currently a resident in South Africa, though he comes from Ghana. So when you hear him talking about his experiences, he will be referencing both South Africa and Ghana. Dr. Chiko Chiweza is a Malawian OB-GYN working at Baylor Maternal Health in Area 25 Health Center in Lilongwe, Malawi. She is passionate about bringing quality care to every mother in Malawi. And lastly, we have Shastra Bhoora, who is a specialist obstetrician gynecologist intensivist, that's a mouthful, currently working at Charlotte Macleay Johannesburg Academic Hospital in the heart of Joburg, South Africa. Apologies for my American pronunciation of that hospital's name. Her greatest ambition is to develop a state-of-the-art dedicated obstetric critical care unit to support Gauteng and its clusters and Greater Africa in reducing maternal mortality and morbidity. All right, so without further ado, we'll start playing our conversation. I'm going to turn off my video, but you will hear the recording once I've loaded the video onto the screen. Thank you all for joining.
Okay, so we should be recording now, and I just want to say thank you again so much for joining in this conversation. And to kick us all off, I wanted to start with the just contextualizing all of your work with COVID. So if you could all give us a snippet of how you've been relating to COVID, whether that is through work or through research or through some other way, just to give us context for what we're talking about. So if I could start with Shastra.
Thank you, Rose. I was thrown into the COVID ocean, should I say, the extremely deep end, at the beginning of March in South Africa. And my main role has been as a clinician. So working with COVID has purely been from a doctor basis background and focusing on the aspect of the pregnant patients that deliver and that come to seek any form of healthcare in our hospital. Also served to draw up the standard operation procedures for my hospital, as well as the clusters that surround us, and also basically help to assist some of the private sector in terms of developing their protocols and procedures when we were first hit with COVID.
Thank you for that context. Nia, I know you're also in South Africa at the moment. Can you tell us more about what you've been doing?
Okay, so my contact with COVID has usually been at work. So our work now involves the management of pregnant ladies with COVID. And then recently, some of our gynae patients who we are seeing also have COVID. So basically, that's my connection with COVID so far.
Right, and just moving up the continent a bit, Chikondi, can you tell us what you've been seeing and doing in Malawi?
All right, thanks, Rose. So most of my work with COVID, just to give you a bit of background, Area 25 is a public-private partnership, so between the Ministry of Health and Baylor College of Medicine. And so we're essentially part of the co-management of the facility. So our work with COVID was not only from the clinical standpoint with the pregnant mothers or any that happened to pass through the facility, because ultimately we routed them to the tertiary care center for the intensive care that they needed. But we participated in the primary care that they realized, including identifying, I guess, testing as well. So the other part was on the overall facility management of a testing center and just the total administration of that. Yeah, that is what I can say was my participation.
Thank you. And with our soon-to-be clinician, Manny, what has your experience been so far?
Hi, everyone. So yeah, for me, I've mostly been focusing on the unhoused communities out here in Sacramento and Stockton. So a lot of like providing resources from like syringe exchange and stuff like that during the COVID-19 pandemic. And then now we're working on potentially like, vaccinating the people out here. So that's kind of been my role a little bit out here. Also through lived experience, like my family's had to deal with it. So like I've been there from like the whole like, getting tested to the hospitalization to the funeral part of everything. So definitely experience and yeah.
Thank you. Yes, I think the personal experience in addition to the work experience is something that I'm sure we've all felt. So lastly, Adrienne, from Public Health World, do you want to share your experience with COVID?
Sure, thanks, Rose. So I've been primarily engaged with the COVID-19 response in America from a public health and emergency management perspective. So that's manifested through work primarily with state and local governments, primarily in Texas, the state of Texas. So that has looked like anything from contact tracing support to after action reviews and alternate care site planning for large metropolitan cities. So not quite on the clinical side, but helping to hopefully push things forward from the back end.
Well, thank you all. I mean, I firmly believe we all need each other to push forward together with COVID. So the next thing I kind of wanted to lay the groundwork for with our conversation was, because we'll be talking about grief, what do you mean when you are talking about grief? And I wanted to ask this because I think that can be quite a hard term to define. So any definition, whether it's a more clinical definition or just a lived definition, is welcome. And I think I will pass it back to Adrienne since you were just talking.
Sure. So in preparation for this, have been thinking about a definition of grief, and I think you're exactly right that it's not so simple. When I Googled to see how it's classically defined, I saw everything from natural reaction to loss or just deep sorrow after loss. I think all of those apply. It's really runs a spectrum and depends on, are you on day 1, are you on day 400, or on year 40 of experiencing this? But I think in the context of COVID, the communal grief, even if, I've been very lucky to not have lost any family members or friends, but to see the, from personal loss suffering that my community is experiencing to the financial devastation, it's been tough to be a part of. So I guess with grief, it feels so personal, and it is so personal, but also to combine all of these cultural experiences and relations to grief in the US context, at least, has been interesting to observe, and I guess also difficult to ingest, right? To say, how do I help my community, even though I'm not experiencing this grief, but as an empath witnessing it, it has been tough. So yeah, I'll stop there, but not an easy question.
I know. I personally think this is a really tough question to answer as well. Does anyone else have a definition they'd want to share, either contrary or additive to that one?
I just want to, in terms of grief, and I think we've experienced it at so many different levels in the last year, but it's this debilitating, intense pain that impacts on the way you actually live your life. I mean, a lot of people have post-traumatic stress disorder where they cope, and like, she rightfully just alluded to, it doesn't matter whether it's 4 days in or 4 years later. Everyone's individual experience is going to be debilitating to each person, and how we deal with it and how we cope and how we move through the stages is so different for anyone that you actually can't finite it to a definition or to a time frame or to a single emotion.
Absolutely. Anyone else want to contribute to that question?
Yeah, I was also finding it very interesting to try and define grief from what we've been through, I think, on a global view, even as a country, or even like if you scale it down to smaller communities as to what grief is. And I thought a particularly interesting angle is looking at it for communities that sort of live their lives together, like in Malawi. Your view of grief or your definition of grief would most likely be based off on how the community at large accepts and defines grief. And I think one of the things that there's the individual component to it, but then again, people will also express their grief based on what is allowed as a proper form of expression in the community. And I think with COVID having, mass forms of grief going around, we saw that expression changing from something that was prior, a very private process, to now something that was sort of everywhere. So I think grief is perhaps sometimes a dynamic thing, that can change depending on how large the trigger is. Yeah, thanks.
Absolutely, that's a really unique take. Lee, did you have something to add?
Yeah, so I think I agree with what most of the other speakers have said. Grieving, it's more like a personal thing, but of course, the community in which you live also shape the way you would grieve. And basically, I think grieving is the experiences you go through after the loss of a loved one.
Like hearing all your definitions, like I wish I would have heard those last night when I was thinking about it. And now I'm like, oh my God, these all are wonderful definitions. Only thing I would add that I thought about like earlier this morning is like also like the process of learning how to adapt and everything. That in itself was part of like grief for me. Like it's like after some type of event, the loss of something or someone, like the process of learning how to adapt and like how to learn like live in life was part of like I think what is grief for me.
That's all great. One thing I was really interested in hearing, sort of in addition to these definitions of grief, is did you feel that definition change at all during the course of the pandemic? It sounds like there's a lot of layers between individual grief and community grief. And have there been shifts, or what did grief look like before the pandemic? So anyone?
Sure. I think I can. I actually, when I was going through the questions, I looked at that question and I found it very, very interesting to sit down and reflect as to what grief was like before the pandemic and after the pandemic. I think other people maybe might have different insights, but I can honestly say on a worldview, I've never been through anything, like what COVID brought out, and it was a worldwide type of effect. So prior, like I alluded before, was that grief used to be something that was private, and the sort of in an African community, but mainly Malawi anyway. Most of the times you find that the more mature you get, the more you're expected to handle grief in a way that is private, reserved, sort of does not affect your other life or anybody else's life. But with COVID, we sort of saw that being broken down and there being more like a public outcry of grief. People were not afraid to grieve openly anymore. They were not afraid to, share it out there. They were not afraid to show that something was not okay. And we saw like parents, we saw, people at the workplace being able to openly talk about their grief and the different things that they were going through. And I think not to preempt the questions coming further, but one of the things that I think we saw was, just on social media. So yeah, I think it really changed a lot of things.
I would agree. The privacy of grief, maybe formerly to the present of it being, I guess, for lack of a better term, in everyone's face. Even employers having to acknowledge, typically you kind of have to suffer in silence or in isolation, and maybe you have an understanding boss, or maybe you don't, to get through what you're doing, or professors or whatever it may be. But it feels like now, whether it's talking about employee assistance programs in America or creating almost, informal help groups or taking time for yourself, whether that's taking a walk or crying it out or whatever you need to do, that there's just more understanding. And I think an acknowledgement of the fact that if we don't give that grace and room for grief, then we won't be able to build this resiliency and be able to move forward. So you have to create space for it, or it's just so prevalent and impacted everybody. Everybody has a story related to COVID, and now unfortunately grief, that there's no way around it. So I hope it creates a new norm in, when this pandemic hopefully ends, that will be a more standard practice, at least in the US context, where it's very focused on productivity, sucking it up and getting over it.
So from my background, usually one way that people are able to cope very much with grief is when people come together to console each other. So with the loss of a loved one, people usually schedule a number of gatherings where they will mourn together and then console each other. I think what happened with COVID is because of lockdown rules and regulations. Most of these gatherings were not affected Can everyone hear me?
Yes, sorry, you
Hello?
froze for a moment.
Oh, okay. Am I back on track now?
You are, yes.
Okay. So I was saying from what I come from,
Uh-oh, looks like we're having more technical difficulties. Lee, can you hear us? So it goes
usually
with
people would cope with the loss of a loved one by having a lot of gatherings, and we usually will have control each other. And what happened with COVID is that it'll be held. And one other elaborates during this event, a lot of people, family members from, but when COVID came and
all right, well, hopefully he can come back online, but Shastra, was what you were hearing from him? Oh, there we go. Oh, you're muted me.
sorry about that. I'm having a really bad network
All good.
here. Okay. So I don't know where I got frozen.
You had left us with normally you can all support each other, but COVID has changed that.
Yes. So with there comes COVID, and now we've got a lot of lockdown rules, and then there's ban on gathering, and so these meetings usually cannot happen. So it makes it difficult for members of the family to be able to console each other. So I think that is one of the impacts that COVID-19 have had on people grieving their lost ones from where I come from.
That's actually making me think of another question I had wanted to ask. With that limitation, has some other habit or other type of sport popped up since you can't necessarily gather in the usual way?
Yes. So what a lot of people have resorted to is try to organize these meetings online. Which is quite successful sometimes. The only limitations is that sometimes you may have members of the family who are not technologically savvy, and so will not be able to join in these gatherings. And that's a little bit of a drawback. And then besides that, I mean, these meetings usually are quite repetitive. I mean, you could have several gatherings before the main funeral event, and all of these meetings are just to encourage each other. Now with now comes COVID, and people don't have the opportunity to have these meetings anymore. And usually there's just a meeting like this, like Zoom meeting, and that would usually include just people that are technologically savvy, and the other people are left out of these activities.
That makes a lot of sense. So when you are talking about this community, are you referring to the Ghanaian community or the South African community or both? I think we lost him again. well, while we wait for him to come back, since my question was about, is that pertinent to South Africa? In your experience, Shastra, have you seen that as a commonality with what's going on in South Africa in your community?
So I think that most communities try to come together when someone has passed on, or when there's a main event, whether it be in mourning or in celebration. You want your family together, you want your loved ones together. And I think that COVID's really exposed a lot in terms of, I've seen either extreme. I've seen some people keep their distance and be elusive about it. I've seen others that do not cope without the human touch. And I think what Nee was referring to was a lot of his own Ghanaian home experience, which manifests and I think can be echoed again in the South African aspect. We are a huge diverse population. I mean, they call us the Rainbow Nation because there's just so many different cultures, so many different communities, so many levels of economic living. And I come from a Hindu Indian background, and I married into a Christian Indian background. And so the feeling from, or how we've grown up, has always been family orientated. And the South African vibe of Ubuntu and being together has been something we've all grown up with. And COVID has shattered this. COVID has shattered a lot in the sense that we haven't been able, I mean, I saw my mom-in-law after a year and 2 months this past weekend, and that too was via social distancing. And, you know, she is watching her grandchildren grow up over Zoom. We've lost family members where we couldn't burn the pyre or do final rites, where we can't go to the cremation and collect ashes in terms of, you know, basically offering those final offerings from a Hindu background. And all of that has been very saddening. It's been very eye-opening. I think a lot of us have lived now in the sense that no one knows what's going to happen tomorrow. No one knows what COVID is going to bring. No one knows what the president's going to say tonight in terms of whether we're allowed to leave our homes or not. So I think that grief has made a lot of people live, you know, in real time in terms of valuing what's closest to them. And I think beyond a shadow of a doubt, it's not the economy, although that's what we need to survive from, but it's our family. And I think that has been the biggest grief. And I know I said this, I think we were about a month in to our level 5 lockdown last year in March, where it was disaster control. So I was the only one allowed to leave my house with the permit in case I was stopped by police, because I was a, you know, vital healthcare worker. And I had gotten to work, and this, you know, all of the stuff was happening and no one knew which direction to go to. And there was no right or wrong answer because we were all living. And I saw someone be very nasty to one of the junior doctors. And I thought to myself, and I voiced it, and I said, the human hurt is going to live with us a lot longer in the term of grief than the actual deaths that we are going to witness. And it's the experience of everything. So for me, the grief has been that it's exposed a lot. There's a lot that our community and our population has been grieving from. But until COVID came and started taking away lives that we didn't expect, that's when it was like, we didn't actually know that this was looming in the shadows and within our own population groups. And beyond COVID, how do we correct that? And that for me has been the real eye-opener.
Absolutely. Your comment about not being able to see your mother-in-law for so long made me think about a personal experience I had at the beginning of COVID, where I attended a funeral via Zoom. And that sense of togetherness but apartness was so apparent because we were grieving for that individual truly around the world. I mean, half of the Zoom audience was in South Africa and half was in the US. And yet when you pushed end meeting, you were alone. And that separateness is so profound and makes the grief seem so much bigger sometimes, but also is a really unique opportunity in some ways. If there had only been a physical funeral in South Africa, I might not be able to go. And that figuring out how to connect with especially family members during COVID has been a unique challenge, and how to support each other, but I think is definitely the challenge. So thank you for that. Manny, I'd be interested in hearing any thoughts coming to your mind as we're talking about this and sort of grief before COVID and after, or during. Can't say we're after yet.
No, I resonate definitely with a lot of what has been said before, and it's just incredible to hear like how we share those experiences like in different parts of the world. So my family's Mexican, and like we're all like, you know, very lively folks. Like pre-pandemic, we would get together like every weekend, and, like just be close as a family. But then like as the pandemic hit, it definitely has changed the way that we cope with like loss. Unfortunately, like because of diseases and whatnot, we've lost a lot of family members over like the years. But we've learned to cope with those things together. Like after every funeral, same thing. We have like a lot of like gatherings and just hugging and embracing everybody. And it made things way better. But now we couldn't do that, and that was so hard. Like it was like a socially distanced funeral, and then everybody went back to their homes. And like, what do we do after that? So we've had to learn how to like cope by ourselves. Which I think some of us have done better and some of us have done worse than as a whole. So it's been a process. It's been really interesting to see that. And yeah, I completely like resonate with like all those feelings, and all those things are they're gonna follow us for a long time. And so we'll see what happens from that. But it's been interesting.
Absolutely. Do you feel like there are nuances between when you are sort of in the Mexican culture and grieving versus the American culture, or any other things you've heard today? Because I've been hearing mostly just similarities. So I'm wondering if any of you have noticed differences when we're discussing this.
I can't talk to nuance. I'm not too sure, but like I just feel, I know it's really nice to hear all the similarities, and it's super special like how we share that. But no, I'm not sure. I don't know if I can speak much for that.
Yeah, it's challenging, but I think there's something amazing about, because one of the questions I really was asking myself when pitching the title of this, Reflections on Global Grief, is global grief something real? Can we identify grief as a global experience? And do any of you have any opinions on that, on whether grief is an individual, a community, or a global experience, or whether it can do all the levels?
I think it can do all the levels. Like Manny just said, I mean, listening to all the similarities is reassuring in itself that the world is actually a rainbow nation that needs to come together, and that we are no different from each other. We live in different parts, we experience different weathers. Some of us have natural disasters, some of us don't, but essentially we're all the same. And I think like we would, accept and admire the differences when it came to animals in terms of birds and cats, and it's the same when it comes to human beings. And I think this pandemic has hit home so hard that it hasn't escaped any part of the globe. So I think everything that you said is important. It's on a personal level, on an intimate family level, on a cultural level, on a bigger global aspect. And I think the fact that there's no differences in terms of how we experienced it is special in its own, because that's the only way we're going to overcome this. If COVID doesn't go away, it's only going to be human nature and behavior that changes the way we live, and we're learning from each other. I mean, at the beginning, I know, in the US, when it was hit really hard in that first wave, and we were getting information coming across from what was happening in Texas Children's and what the differences were being done through Baylor College. And I used to read all these emails and think, oh my word, I don't think we'll ever be able to cope. And we have. It was just that, you'll be able to do it. You just need to believe in you and your team. And we will get through it. And I think that for me, in the grieving aspect, is that we're here to support each other, if nothing else. And I think that in its own, if COVID never had happened, and I'm not saying it should have, but I think if it never had happened, we would have never explored the uniqueness of humanity. And I think for me, that's really come through. And so when I'm listening to everyone, and I just, that human touch, Manny, I just want to like stretch out and give you a big hug to say, I'm sorry. I'm sorry that you felt pain. I'm sorry that you've lost loved ones. I'm sorry that you were the one that had to walk away and there was no place else to go. And so that redefines who we are. And I think it makes grieving a little bit more tolerable, knowing that we're not alone.
Yeah. So just to, I agree with the sentiments that have been shared. And I think just to add on a bit of my own experiences, one of the things that we saw on reflecting again was that I agree with Shastra that it really just made us one whole rainbow nation, you know, as a globe, that we were reacting the same way to the same trigger that was COVID. But an interesting sort of nuance that I found was studying how different levels of information were available to, I guess, different parts of the globe. So, for example, you could say in America, or what we saw from TV anyway, was that most people had access to information. They had access to scientific research and advances that were happening in medicine, whilst as on this side, more especially I can say for Malawi, and especially around Area 25, it's a semi-urban area. So some of them have access to, you know, TV channels and things like that. And others are from the rural area, and Rose, you can identify they don't have access to anything. But there was this sense, you know, from everyone to participate, you know, whether in the grief or something like that, by having a sense of needing to do something. So we saw a whole number of new practices emerging. There was people selling eucalyptus leaves on the roads, you know, to people that had lost loved ones or were either had COVID themselves. You had people circulating all sorts of things on social media, you know, as somebody was crying out. And the particular thing I'd like to highlight that Nee mentioned earlier about, you know, this, and Shastra also mentioned it about funeral rites, is that in Malawi, we also are very particular about, you know, last rites of a person. And it has to be done right. And usually when somebody's dying, if they are aware, they will often ask that their funeral go a particular way. But with COVID, that couldn't happen. We saw people that were initially averse to social media now, you know, filming the funerals on social media so that everybody from around the world could participate. And that was initially something that was even considered a taboo, but now it was being done to still have that togetherness. I remember once one of my parents' friends passed from COVID, and for about a week or so, my parents started steaming with eucalyptus leaves and ginger. And I mean, they're both well educated, and I tried to tell them, you know, the scientific backing behind these interventions, whether worth it or not. And just, I think for them, it was comforting, you know, to be doing something about the grief that they were facing other than to just sort of deal with it using other forms. So that was quite interesting on the things that we saw this side.
Yeah, that's really interesting to hear, and directly feeds into one of the questions I wanted to ask about any specific habits or programs that either you've developed personally or that you've seen in the community. And that sounds like like they just want to have control over something, and you can control
exactly
your eucalyptus.
And your ginger.
So has anyone else seen certain practices or habits crop up during this time?
steaming is something that a lot of people have spoken about and have been doing, especially when we looked at some of our patients that were coming in for antenatal care. And we basically needed to guide against, not having such boiling hot water that you would actually scald your face or anything of that sort. So that has been one thing. I think it may blend in with the eucalyptus. The other practice that I think we should have done a long time ago, and I know a friend of mine, when I used to go visit her at her home, she's from Taiwan, used to have a little box where they used to put shoes outside. And so when you walked into your home, you either walked in with a clean pair of shoes, like home wearing shoes, or a clean pair of socks. And we've adapted that in my home because of contact surfaces. So there's sanitizer spray at the door, and you'd spray your shoes, you take it off, you'd spray your hands, and then you have a new set of shoes that you'd walk in with. And then the whole routines of the washing in of hands and the washing of masks. So in my home, that's a routine. I mean, my 4-year-old son knows he needs to do that, and that's changed from how we had done things previously. In terms of any type of anecdotes or any remedies that people have tried, I know my mom's tried to make us take honey and haldi, which is like turmeric powder that has anti-inflammatory properties. So that's going to be like, I'd get this message almost every morning, add some black pepper now, add a spoon of brown sugar now. And I'll be like, Mom, I'm not taking any of this. She's like, but you stand the whole day in your PPE and you need the nutrients. And so it all comes from a really good place. And I echo what Chiko was saying in terms of it's not scientific and these are all educated people, but I think at the end of the day, if it's not going to cause you any harm and it could be of benefit, why not? And there just hasn't seemed to be any right or wrong answer. I mean, all the regimens from a medical point of view that we've been using for ICU admissions, started off with the hydroxychloroquine, and then it went to the high dose vitamin C, and then it went to the high dose vitamin D, and then we were adding, this concoction and that. And now months later, it's like, sorry, but none of it actually matters. So it's almost as if what we were doing at home, and it's just been so divergent and evolving in directions that we didn't feel. Now we've got the vaccine, which has reached South African shores, proudly wearing my badge, and we still don't know if that's good enough for the different strains, for what COVID is. So the practices change according to what's happening currently or what the experience have been in the past. And I see it in the next 2 or 3 weeks, when we experience the third, the fourth, the fifth waves, that whatever we knew or whatever we were practicing in the past year or so may be very different from what we're going to end up doing. So I think it's a very dynamic way in terms of how we practice and what we do during COVID.
Yeah, that's so interesting to hear, because I'm not only hearing sort of a desire to have some semblance of control, but I'm also hearing really consistent themes of creativity, both professionally and personally, and thinking, here's this complex catastrophe. How many angles can I come at that with? Ginger on one side, vitamin C on the other side. And that's really special to hear.
I wanted to note too, if I may, I'm one of the non-clinicians in the room, but I'm really grateful to hear this understanding approach to what you're taking. If it's not harmful, why not? Because I do think to quell this hopelessness and helplessness that people are feeling, because you can do everything right and still not get the outcome you anticipate. So I think it's wonderful, again, from a kind of resilience perspective, that's encouraged and accepted, because I think humans are complex and dynamic, and just following the public health or medical rules to the book may not cut it from the humanity perspective. So it's wonderful to hear that there's no shaming about it, but understanding that it's a combination and approach to maintain wellness and hopefully achieve safety.
Yeah, I think as Shastra was also talking, I remembered, and Rose, you mentioned it, I remembered something that had also happened in Malawi. And I think one of the differences or new things that we saw was that previously, most of the health system in the country is run by Ministry of Health. So that's the government. There's few private institutions. And so most of the healthcare guidelines sort of come from them. And with COVID, the first wave came around March the previous year. And around that time, it didn't hit too bad. We used to get about, 20 cases in a day, and we only had a few thousand cases. This was in 2020. But come 2021, the second wave was just so much worse than before. And we saw a lot of notable figures dying, politicians, famous people, musicians, and people that almost everybody that you knew, was affected in some way. Either they were sick, or they were dying, or they had lost a loved one. And we saw, because before, people would often castigate the Ministry of Health for any failed health efforts. But this time around, people sort of came around to say, what can we do to help, as opposed to pointing fingers at the government for things that they're not doing. It won't stop the numbers of people dying. And even if we say there's a lack of oxygen concentrators, it won't stop, your loved one that's in the isolation center dying. So we saw so many different groupings, churches, community groups, medical groups, professional groups coming around to make initiatives to actually assist government. And this was quite phenomenal because it was something that had not been done, before at such a large scale. If anybody needed, expert medical care before that, they could easily fly out of the country. But with COVID, that wasn't possible anymore. So it was like people took a look around them and said, okay, other than what the government has done, what else can we do? And I remember one such effort by the Malawians that are living abroad in different countries like the UK, US. They came together online and they said, what can we do? And they started sort of like a GoFundMe project, and they raised about 15 million kwacha. That's roughly, how much money would that be, Rose? Like in dollars?
I can't do that math off the top of my head.
Okay, I'm sure but it's somewhere around like 10,000. No, actually $20,000. Yes, 15 million is somewhere around $20,000. And there was a large outcry, for oxygen concentrators, oxygen cylinders, oxygen, money to buy oxygen fill-ups for the cylinders. And they managed to use all this money to outfit the 3 main centers. And I remember that was one of the biggest collective efforts, that we have seen of the community rising up and saying, we can do something about what we're seeing. So I think after that, they're still, as we speak, working on ways to sort of maintain that effort and create something solid out of it. And I think that was a positive difference in a response that we saw.
That's great to hear, and so special to think of communities coming together, and if there is any frustration with the response, funneling that into action in one way or another. Also really notable to hear that just as we were talking about having compassion for people who want to use eucalyptus or other personal measures, similarly applying that compassion to the government or the medical systems who are also trying to figure out their response and their sustainable methods for managing this and learning as they go. Which brings me to probably my final question for this conversation, which is really around lessons learned and anything that you will carry forward, whether that's personally or professionally or something you hope to see in your community, as well as something that maybe you would have done differently. If you have anything there, please go ahead. So whoever wants to start.
I think from a personal perspective, I realized that I'm irreplaceable in the workplace, but I'm not irreplaceable at home. And, being career driven from a very early young age, it was always about becoming a doctor, specializing, subspecializing, getting a master's in this, writing a thesis in that. And I realized that my most important name versus doctor, professor, master's, whatever it is mom. That used to get me driving when I came home after my 30, 40-hour shift, being in PPE, sweating it away, not being able to get to my food, and walking through the doors and realizing my son's face. He was like, but I can't touch her. And he'd be, wait, mommy, you dirty still, you dirty. And then he started learning and this, about the virus. And he was like, no, you need to wash out the corona. And he was great. And I strongly believe that he really was my saving grace during the grief that COVID brought through. And I wouldn't give that up for the world. And so nothing else mattered to me than being able to come home at the end of the day. And it's a pity that it took something like COVID for me to realize that that was my most important title.
That's a beautiful touchstone. You made me a little weepy. Anyone else have a lessons learned?
Yeah, that's very precious, Shastra. Thank you for sharing that. I think for me, from what I saw a lot of people go through, I think part of the intense helplessness and hopelessness that people went through could have been helped with just, a little more information. Because I think part of the panic that people went through, the second wave, and, then after that, the vaccines, and it's dying down, but it's still there to a certain extent. And I saw that it worked to compound the griefs that people were going through. You would go bury your loved one, but as you were returning, you did not know whether, what else you need to do to make sure that you save the ones that are at home and you're not any more of a danger to them. Even when you went to work, there was enough information, but when you were coming back and you discovered that your colleague who you were with yesterday and you happened to have taken your mask off was now COVID positive, you did not know whether, when you come home, what do you do with the ones that are there? Where do you get, tested and things like that? So there was quite a large gap in information. And I think on the global scale, there was a lot of efforts, but I think some of the things that were not accounted for is if the information that was being shared was actually reaching its intended audience the way it was intended to be sent out. Because you would find all these scam articles, being shared through WhatsApp, supposedly written by the WHO when they were not actually written by them. And there were so many things that caused people to go into a frenzy of panic, at a time when perhaps they could have been processing their grief a little better, than they were. So I think that's definitely an important lesson.
Absolutely. Adrienne or Manny, do you have any final takeaways or lessons learned you want to share?
Sure, I'll go quickly. I think maybe similar to the experience shared in Malawi, in America, we're very individualistic, but I think during this time we realized the importance of taking care of each other outside of the confines of government. So understanding that government isn't nimble nor always well-funded enough or has the political will to do what needs to be done. So, creating food pantries that are open or community fridges or providing childcare if people needed to work and children were out of school or whatever it may be, but just taking care of each other and realizing we can get a lot more done And it doesn't take much, but just looking out for your neighbors, which shockingly isn't always the case in America. And otherwise, I guess from a personal lesson learned, I would probably have set more boundaries for myself throughout my work on the COVID-19 pandemic response. You know, we've mentioned, are all experiencing our own forms of grief. So to understand that although I'm an altruist and a public health professional and, you know, really a person of service to my community, that I'm allowed to pump the brakes and do what I need to do for myself too during a stressful time.
For me, like, yeah, like, thank you all for sharing. Like, all those are like beautiful things to hear. For me, like personally, it took my therapist to help me figure it out, but like, it was just like I kept living in like the future, like thinking of like what could happen next, what could happen next, what could happen next. Like I would look at numbers every day, and like I would be like, oh no, the numbers look like this. Like, what's next? What's gonna happen? Who in my family's gonna be affected? But for me, what I ended up learning is just kind of like live like day by day, and they made things so much easier as opposed to thinking like what's next, which caused like crazy anxiety. And so that in itself has been like very comforting, and like it's been, I think, a healthier way of living right now. So
I completely agree. It sounds like we all pretty much just got a reality check on our priorities, and getting those sorted is into a sustainable structure is a key component to being able to carry on. Well, thank you all so much. This was such a beautiful conversation, and I really appreciate you taking the time for joining. So thank you, and I'm going to stop recording now.
All right. Well, like I said at the beginning, that was our pre-recorded conversation with the panelists, most of whom couldn't be here today due to various conflicts and time zone differences. So I see we only have 3 minutes left, but if anyone in the audience has a comment or wants to contribute to our understanding of what's happening around the world with grief and COVID, please feel free to unmute and join in the conversation. We've only got about 2 minutes left. And if we don't have anyone,
Rose, I will say something. I put it in the note too, but I wanted to thank you. This is a topic that we don't openly talk about, and I think this is one of the key themes that we do have to talk about. We do have to process, to use it more in psychological way, because I think that the trauma that has been created since last year to now, and we don't even know for how much longer, I think we're going to be seeing the effects of it for years to come. And not only in adults who, let's say, they have more of an ability, if you will, to process it in one way or another, but with kids, with young adults, and we have started seeing many of those results already. But it's something that we're going to have to cope, both as clinicians, but also as citizens. You know, it's if someone is disturbed next to you, not because he's mentally unhealthy, but because of the stress that we all have been going through. And I think that if there is someone right now that says, I am very cool, I would worry for that person. Because it's very normal right now, and we should be stressed. It's normal. What we have been going through is unprecedented. So this is a very healthy response. And I think part of the community building, if you will, and planetary health is how do we come all together to grieve this part, to grieve the loss of life, to grieve the loss of nature, to grieve the loss of the environment. All this is a bigger grief than just the COVID grief, right? It has multi-layers, and I think, thank you for bringing this at least into our awareness and to the inclusion of this conference and celebration, because it's something we all need to become more capable to work with. Not that we are, how can I put it? Not that we know how to deal with it, but that we all come together to find the ways to work with it. So thank you.
Well, thank you for that comment. I mean, that is exactly the reason I wanted to just round up a group of people from different corners of the world and have us all talk about grief, which is something I don't think you can escape in your human experience. And as you were mentioning, is going to be, well, is already looming with various planetary health aspects. And I often think of it in the terms of climate grief and communities going through various environmental disasters. You could probably tell in that conversation, my family is South African, but I grew up in Texas. So I'm well acquainted with hurricanes in particular. But yes, I think gaining the vocabulary on what we mean when we're talking about grief, as well as the acceptance that having a grief experience is nothing to be ashamed of and something that we should recognize is so important. So thank you for your comment. That was exactly what I wanted to hear.
Thank you.
Mm-hmm. Well, anyone else before I end this meeting? All right. Well, thank you again for, number one, not being intimidated to join in a call that has the word grief in the title. I very much appreciate that. And for being willing to listen to this conversation. I was really struck in rewatching it just now by how little all of these very clinical or public health oriented people talked about their work so much as their human experience. And I think that in itself is really telling about what grief does to us as a community and as individuals. So thank you. Where I am, it's currently mid-evening, so I'm going to wish you all a happy evening. And I look forward to seeing some more of you at the rest of the conference. Bye, y'all.